Hello everyone, in this video we are going to discuss about the nerve supply of the upper limb. First, coming to the shoulder region, the muscles are deltoid, supraspinatus, infraspinatus, teres minor and subscapularis, teres major, serratus anterior, trapezius. So the rotator cuff muscles are supraspinatus, infraspinatus, teres minor and subscapularis. Except the supraspinatus and the infraspinatus are supplied by suprascapular nerve. The subscapularis, as the name suggests, it is supplied by the subscapular nerve. The teres minor is supplied by the axillary nerve, and also deltoid is supplied by the axillary nerve. So teres minor and the deltoid is supplied by axillary nerve, supraspinatus and infraspinatus by suprascapular nerve, subscapularis is supplied by subscapular nerve. Next, teres major is supplied by lower subscapular nerve. This lower subscapular nerve will also supply the teres minor. Serratus anterior by long thoracic nerve, trapezius by spinal accessory, and sensor is supplied by C3 and C4. Next, arm muscles. The anterior compartment of the arm, that is flexors, are supplied by muscular cutaneous nerve. Posterior compartment, extensors, are supplied by radial nerve. And also the lateral part of the brachialis is supplied by the radial nerve. Next, flexors of the arm are supplied by median and ulnar nerve, a branch of median nerve also. So these are the muscles which are supplied by median nerve: pronatus teres, flexor carpi radialis, palmaris longus and flexor digitorum superficialis. And others like ulnar side nerves are supplied by the flexor carpi ulnaris, are supplied by the ulnar nerve. Next, lateral half of the flexor digitorum profundus is supplied by anterior introitious nerve or median nerve. Medial half is supplied by the ulnar nerve. Next, forearm extensors are supplied by radial nerve and radial nerve branches. So anterior flexor compartment is taken by median and the ulnar nerve. The posterior extensor compartment is taken by the radial nerve and its branch is posterior introitious nerve. Anterior introitious nerve is a branch of median nerve. Posterior introitious nerve is a branch of radial nerve. Then hand thenar muscles. Next, we will see the intrinsic muscles of hand. Extrinsic muscles of hand are nothing but this forearm muscle which are actually inserting on the hand. This helps in coarse movements of the hand. But intrinsic muscles like thenar, hypothenar, lumbricals and introitial, these helps in fine movements of the hand. So thenar muscles are supplied by the recurrent branch of median nerve and also ulnar nerve. So abductor. So these are the group of thenar muscles. Thenar muscles are nothing but which are towards the thumb side. Hypothenar muscles are towards the little finger side. The hypothenar muscles are supplied by the ulnar nerve. Next, lumbricals. These are intrinsic muscles of hand. There are 4: 1 and 2, 3 and 4. 1 and 2 are supplied by median nerve. 3 and 4 are supplied by the ulnar nerve. 3 and 4 are towards the little finger side, and 1 and 2 are towards the lateral side. So lateral side is towards the median nerve. 3 and 4 are by the ulnar nerve. What is this function of the lumbricals? They flex at the if this is the hand, they flex at the metacarpophalangeal joints and they extend at the interphalangeal joints. So they scalp. This is the function of the lumbricals. Next, introitious muscles of nerve. They are 2: palmar and dorsal introitia. Palmar introitia will help in adduction. Dorsal introitia will help in abduction. So these are supplied with ulnar nerve. So all the intrinsic hand muscles are supplied by either ulnar or medial nerve. No radial nerve is there. Radial nerve is not supplied by. Radial nerve does not supply any of the intrinsic hand muscles. We have to remember this. Next, injuries. This is the most important thing. Injuries of the nerves and their clinical significance. Axillary nerve injury will cause regimental bad sign because there will be sensory loss over the deltoid region, and motor deficit. There will be deficit of deltoid and teres minor, because teres minor is the rotator cuff muscle which is supplied by the axillary nerve along with the deltoid. So there will be motor deficit of this. So there will be flat shoulder and also weak abduction. Muscular cutaneous nerve helps in flexion. So there will be loss of elbow flexion and also supination, and also sensory loss of the lateral forearm. Radial, median, ulnar nerve and long thoracic nerve are most important. Radial nerve injury will cause wrist drop, and also if there is only superficial radial nerve injury, it will only cause sensory loss over the lateral 3.5 fingers or sparing of the fingertips, because fingertips are also supplied by the median nerve. Next, median nerve injury will cause ape hand or hand of benediction. This is the deformity. Because next, ulnar nerve injury will cause claw hand or ulnar claw, or Froment sign is positive. Claw hand and Froment sign is most important thing, because ulnar nerve will supply adductor pulses. So this is the small test. We will ask the patient to hold a piece of paper between the thumb and the other fingers. So normally the position of the thumb will be like this because adductor pulsus is acting. But whenever there is an ulnar nerve injury, weak adductor pulsus will be there. So to compensate it, they will hold the paper with using the phalanges. There will be flexion at the interphalangeal joint. So this is Froment sign. It will be positive in ulnar nerve injury. Long thoracic nerve will cause winging of scapula. We can ask the patient to do wall push-up test by holding both his hands towards the wall and pushing the wall. We can see winging of the scapula here. Suprascapular nerve, it supplies supraspinatus, infraspinatus weakness will be there. It is a pure motor nerve. There will be no sensory loss. Thoracodorsal nerve, there will be latissimus dorsi weakness and weak adduction, extension and internal rotation. Fold. Next, spinal accessory nerve, it supplies trapezius and sternocleidomastoid mastoid. So there will be paralysis of both. There will be no sensory loss. Here shoulder drooping and inability to shrug the shoulders. So one thing we have to know is no hand muscle is supplied, intrinsic hand muscles are supplied by the radial nerve. Most of the medial side muscles are supplied by ulnar nerve. Most of the lateral side, palmar side muscles are supplied by medial nerve. If it is in the dorsal side or extensor side, then it is laterally, it will be supplied by the radial nerve. Medially it will be by the ulnar nerve. So this is a general view. So this is the most important diagram we can see. As we can see, the lateral side is supplied by the median nerve, medial side is supplied by the ulnar nerve, lateral side is supplied by the fingertips are supplied by the median nerve, medial side are supplied by the ulnar nerve. But whenever there is a posterior action, there will be superficial radial nerve which supplies the lateral fingers, sparing of the fingertips. Most of the extensor compartment is supplied by the radial nerve. Medial cutaneous nerve will supply the medial side, and medial cutaneous nerve of forearm. This is the medial cutaneous nerve of forearm which supplies the medial side of the forearm, and this is the axillary nerve, and this is the intercostal brachial nerve.